Hello, and welcome to Radiance Revealed, the podcast. I'm your host, Dr. Jen Haley. I'm a board-certified dermatologist, fitness enthusiast, nutrition expert, and global explorer that over the years has uncovered that your skin is a true representation of your internal health. Each week, we will chat with leading health, wellness, and even spiritual experts who will reveal secrets to true health and vitality. My goal is to help you change small habits to give you the power to create a more balanced, aligned, and elevated version of yourself. Now let's dive in. Hi, everyone. Welcome to this week's episode of the Radiance Revealed podcast. Please bear with me. I just had oral surgery a few days ago, so if I sound odd, I apologize in advance. And I am committed to providing you continuous education this year. So despite feeling lazy or having any medical obstacles, I am going to be there for you. I have gratefully received a number of questions and DMs through Instagram regarding some questions. So this episode is going to be an AMA. And I'm going to answer your questions. So in future episodes, if you have questions, of course, I can't give medical advice. This is general information. So when I speak, I'm speaking broadly and I'm giving general information. I'm not giving any personalized advice. But I can discuss your questions. So hit me up on Instagram or connect with me on my YouTube channel as well. And both links will be in the show notes. So the first question we have this week is, what do I look for in a sunscreen? There are so many options. So yes, this can be confusing. And if you're listening overseas, it's going to be a little bit different than what we may have available in America. But my job is to make things as simple and as straightforward for you as possible. So as I've been discussing and preaching for many years, because I have lived in Hawaii and I do understand how a lot of these toxic chemicals and sunscreens can affect the coral reefs, as well as our internal health in our body through their endocrine disruption or even allergic reactions. I've always been a proponent of using a physical sunscreen. Excuse me. So I mentioned earlier on one of my Instagram reels that even in the wintertime, you should be applying sunscreen to the quote high real estate areas, the areas of the body that are exposed to sun every day that really will show our age after 20, 30, 40, 50 years. So despite where you live, I recommend wearing sunscreen to your face, your neck, your chest, and the back of your hands every single day. And what you want to look for in a sunscreen is zinc oxide. That's the most common and likely the best ingredient. It's inert. It's not going to be absorbed by your body. Titanium dioxide is the other ingredient you want to look for. So most sunscreens will have zinc as a primary and titanium as a backup. And what the technology has done over the years so that you don't have the big white nose like the lifeguards did in the 60s and the 70s is the technology has micronized the particles. So they become more of a powdery formulation and can blend pretty nicely with skin. And because it's a physical barrier, it is solely dependent on how thickly you apply it. So if you're listening to the podcast, I urge you to look on YouTube because I'm going to do a demonstration of how I want you to apply sunscreen. So after looking at tens, if not hundreds of thousands of people over the last 20 years, doing full skin checks all the time, diagnosing thousands of skin cancers, I see a pattern. I see, people who wear sunscreen even regularly, what they'll do is they'll apply the sunscreen to the central part of their face and it becomes thinned out as it reaches the periphery of the face. Or the periphery of the face does not get applied, or the side of the neck does not get applied. So for men in particular, I call this the danger zone. It's basically right in front of the ear on the left side in the US, and the ear and behind the ear involving the neck, because that area is not getting protected and it's getting in the sun every single day while you're driving the car. And we know that ultraviolet A rays can transfer through windows. So I have one of the sunscreens I like here. It's called Skin Better. And I'm going to just demo. So you basically apply it to your hands and then apply the periphery of your face and then your neck and bring it centrally. So apply centrally all the way up to your eyelid margins, right? Take the leftover that's in your hand, apply to the backs of the hand for the incidental sun exposure you're getting all day long as you're driving in the car, as you're walking to and from the store. So this is how we want you to apply sunscreen daily. So we're looking for zinc oxide, SPF 30 or higher, plus or minus titanium dioxide. You want to avoid octinoxate. You want to avoid, there's a salicylate type of sunscreen, and I don't even like avobenzone. Some people will argue that avobenzone will do an adequate job of protecting UVA rays. I used to use avobenzone when I lived in San Diego. I was running marathons back then, and I've never been tanner. Because what happens with the chemical sunscreens is as the ultraviolet radiation is coming down on your skin, the chemical sunscreens have a reaction. And as the reaction occurs in an attempt to protect you from that ultraviolet radiation, it also neutralizes or makes that particle no longer active. So the longer you're wearing it, the less active it becomes. Whereas the physical sunscreens, as long as they are in place, they are protecting your skin from the sun. So I pulled a couple here that I like. I like Elta MD. It's available pretty much everywhere. I prefer the Elements. This one's called Restore, and there's a whole bunch of different ones. You want to look for titanium and zinc. You just flip over the label. If you see me on YouTube, you can see the label has titanium and zinc. Okay, Isden is another nice sunscreen product. This one is not tinted, but it's very lightweight. I find that it even blends with my skin of color patients without making skin look ashy, which is often a problem. If you have any skin of color, the sunscreen can make your skin look really ashy. And this has zinc oxide. Flipping over the label, we're reading the ingredient. I really love Elastin skincare. It's a little darker, so I tend to blend personally from my skin tone. I tend to blend the Elta MD Elements with the Elastin every morning, and I blend that all over my face. That's all I have on my face right now is just tinted sunscreen. Illumier MD makes some really nice sunscreens. They have a moisture matte, and then they have sheer hydration, and then there's an ultra sheer, just depending on your skin type. If you have oily, acne-prone skin, you're going to want to use something that's really lightweight. And if you are prone to hyperpigmentation or melasma, if you're someone who struggles with any pigmentation issues, as do I want you to look for a tinted sunscreen. So tinted sunscreens have the addition of iron oxide in them. And we know that hyperpigmentation, whether it's melasma or post-inflammatory hyperpigmentation, the dark spot that's left after a rash or acne, we understand that this type of pigmentation is very dynamic and it's very sensitive to all different types of light, not only ultraviolet light, but also visible light, the light coming from the computer right now, the overhead lights. So the tinted sunscreen containing iron oxide is going to help treat and help fade and help prevent hyperpigmentation. And it doubles as a makeup. So most women really, really like tinted sunscreens. And I named a couple. They work for me. Basically, you want to find anything that's SPF 30 or higher with zinc oxide, plus or minus titanium dioxide, and that you like, that feels light on your skin, that doesn't feel sticky or like plastic on your skin, and that you are going to wear every single day. And applying it from the outside of the face to the inside of the face, up to the eyelid margins, because we want to protect those areas, getting the neck and getting the back of the hands every day before you leave the house. Now, sunscreen is a backup method. So I prefer a hat and I prefer clothing. And when I lived in Hawaii, pretty much everyone there wears rash guards. So we could always tell who the tourists were. It's not feasible to apply sunscreen all over your torso. You're going to go through an entire bottle with one use. So rash guards and sun protective clothing are what is recommended if you're spending a day at the beach. Now, I think a lot of you understand my take on exposure to sun. So for the areas that are going to age the quickest because they're exposed all the time, all year round, those areas I want you to be wearing sunscreen on a regular basis. Now, in order to assist with vitamin D production and getting the energetic life force from the sun, I am not opposed to exposing torso and legs to the sun 3 times a week for maybe 10 or 15 minutes. You should not be getting a burn. It should be enough to just feel like you got a little energy. It's a feeling that you're going to intuitively notice, but not enough where you're getting a burn and definitely not enough to get a tan. So I will hike a couple times a week and just, wear a sports bra. And I still have a hat on my head to protect the facial skin because I live in Arizona. But I do see people that live in colder climates that have a lot more sun damage than me living in Arizona, and people that follow my advice in Arizona because they're not protecting those high real estate facial, neck, and hand areas throughout the year. If you have kids, which my children grew up in Hawaii as well, and now we live in Arizona, they don't follow my advice now as teenagers very much, but we used Vanicream. So I like Vanicream. It is really, really, it's a little bit heavy as an adult, in my opinion, to use on a daily basis. But for kids, they can rub around in the sand and it's not going to come off as easy. And this also contains zinc oxide, this Vanicream, and it's very, very low in chemicals. It's free of dye, fragrance, masking fragrance, lanolin, parabens, and formaldehyde. Created at the Mayo Clinic many years ago. Their products are excellent for children. So as far as reapplying, I'm going to admit I am horrible at reapplying, but what I do like is I like these powder brushes. Color Science makes one, and there's another one I'm going to order from called Brush on Block. And basically it is a brush and you just apply it and it's water resistant. So if I'm going to, I don't know, go for a hike or go for a run in the afternoon, I'll brush it. Or if I'm feeling like I'm a little greasy on my face, I'll brush it on the center part of my face before I go outside. I consider these brush on powdered sunscreens as a way to fill in the blanks. They fill in the blanks of what you've already applied topically as a cream. I don't like them alone as a sunscreen. I think they give a false sense of protection. So the worst thing that somebody can do is have a false sense of protection of thinking that they're applying sunscreen and they could spend all day in the sun. And I see that really a lot with the body. So if you are going to the beach, please cover up, I'm not going to go on about that. The other thing that I think is not discussed often, I personally observed this over the years, is what you eat will give you protection from the sun, or it will make you more prone to damage from the sun. So if you're eating seed oils, if you're eating canola oil, safflower oil, soy oil, which is pretty much in every single pre-mixed dressing or marinade over the counter, because the ones that contain avocado oil or olive oil are going to be 2 or 3 times the price. These oils are extremely cheap. Then that is going to make you more predisposed to getting a sunburn and negative effects from the sun, as opposed to if you have a diet high in polyphenols. So if you have a diet high in polyphenols and astaxanthin and beta carotenoids, then that is going, though all of those colors that are natural in nature, that are in the algae, that are in the fruits and vegetables, that impart the color in the fruits and vegetables, all of that, those polyphenols are going to impart a natural protection to your own skin. So think about that. What you're eating every day, what you choose to eat. Are you eating a potato chip, or are you eating a purple cauliflower or a carrot, right? Or are you eating wild salmon? I mean, all of those choices are going to either improve the natural protection of your skin or harm you. Okay. So you have control over this. And, it's not an all or nothing kind of thing. You all know that I believe in the compound effect. It's a most thing. So just remember that. There also is a wonderful supplement, and there is a lot of research on this in melasma and UV protection. They can't state that they increase the SPF of your skin, but studies show that it can increase the SPF of your skin about to a 7, let's just say. But I take it every day. It's called Polypodium leucotomus, and it's a fern block extract. So it's Polypodium leucotomus, and I know about it in a number of supplements. There is HelioCare. HelioCare, HELIO Care, has been around for a while. You can get it at, I think, Walgreens or online. There's also SunSafe RX. And then there's a gummy variant as well. And I'll have those links in the show notes for the different names. I can't remember offhand the gummy name, but it's made by a dermatologist and it has polypodium leukotomas. So it can help prevent the DNA damage, help prevent hyperpigmentation of the skin, and help with the natural SPF of your skin. So you really want to learn to protect your skin from the inside out and from the outside in. Okay. Sunscreen is a backup. Hats, clothing is your primary. A little bit of sun is good. Okay. And you really want to, always have your vitamin D levels checked. And I find that most people need to take vitamin D supplementation, even if they are getting some sun. But that needs to be checked, get a baseline, and then we'll go into a deeper dive on vitamin D in a follow-up episode. Okay, so I think we covered that subject. The only thing I wanted to mention also is don't look at the advertising. So I even get overwhelmed if I go to Walgreens or CVS or any of those places, and I look on the shelf and I'll see like 20 different sunscreens, all from Neutrogena, for instance. And then I'm reading the label. I'm like, oh, okay. This baby sunscreen is the same as sensitive skin sunscreen, which is the same as eczema prone skin sunscreen. So don't even read the labels, just read the ingredients. And then as long as it has zinc oxide, titanium dioxide, avoid the chemicals, and then make sure you like the feel. Because if you don't like the feel and it feels gross, you're not going to wear it. So that's the key to that. I hope I answered that question and I didn't confuse you anymore. Okay. Second question. My skin gets really dry in the winter. Is there anything different I should do for my skin? Okay. Yeah, there's a lot different you can do. So I want you to start reassessing your skincare products and changing them every season. So, as we learned in our Skin 101, our skin takes about, 4 to 6 to 8 weeks, even 12 weeks, depending on your age, to go from the bottom layer to the top layer. So, you really need to give a skincare regimen about 12 weeks to adequately work and get optimal results at that time. But also our seasons are about every 12 weeks, right? And there are different seasonal changes where we want to address different concerns during the seasons. Now, so let's talk about rhythm and cycling. So women cycle about every 28 days or so, more or less, right? We cycle with the moon typically. Men cycle on a 24-hour basis. So you guys are simple as far as skincare goes. Women can actually change their skincare through their menstrual cycle. But I want to just focus on seasonal skincare changes now. So let's talk about what I want you to do in the winter. And then in the spring, we'll talk about what to do in the spring. So in the winter, basically, what happens is the heat turns on in the house, the humidity drops. So we're always in homeostasis with our environment. So if the heat drops in the house, the humidity drops in the house, there's cold air outside, sometimes there's more wind on our face, it's really stripping our skin barrier. And our body's trying to reach osmosis basically with the outside world. So the moisture is going to be drawn out of our skin into the environment when the humidity is low. So, I mean, just living in Arizona, my skin doesn't look as good as like when I lived in Hawaii. I have to add a lot more moisture to it. So in the winter, you want to add hydration. You want to decrease the amount of retinoids you're using. So just say you use a retinol every single night, you may want to, and you're noticing that your skin is dry, you may want to back that off to 3 nights a week. And as long as you're using your retinol or any of the retinoids, if you're using a prescription retinoid, then you're going to get results. So as long as you're doing it 3 times a week, you're going to have results, the anti-aging benefits, the acne benefits, all the other benefits we see with retinoids. If you're not having dryness, then keep your retinoids the way it is. Okay. You want to exfoliate less. So in the summer months, we may be adding an alpha hydroxy or a beta hydroxy acid or some enzyme exfoliators 3-4 times a week. In the winter, not so much, once a week at the most. If you're struggling with dryness, I'd say leave it out. Okay. So exfoliating less, retinoids less. We're doing everything that we can to improve our skincare, to improve our epidermal barrier and keep those keratinocytes protected. And that will also help you not getting infections and colds and stuff like that, because our skin is our biggest barrier to protect us from the outside world. So, I mean, I have one son who's a wrestler. He's always getting cut up and, the risk of infection is super high. So we know that our skin barrier is essential. We need to keep it healthy in order to protect ourselves from getting infections and other sorts of dermatitis conditions. So how can you increase the hydration of your skin? So in the morning, use a cleanser that might be a more gentle cleanser than you may have used in the past. And I've mentioned before that I like salicylic acid cleansers, but maybe you just do that at night in the winter time if your skin tends to be a little bit dry, to remove the makeup and a lot of the grime and help gently exfoliate. In the morning, use a mild cleanser. Skip the toner, apply your vitamin C and E product, let it dry completely. And then what I like to do is I love these thermal spring waters. La Roche-Posay makes one. Aven makes one. And I love these just thermal spring waters. You could buy them anywhere. And you just spray, 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 neck and face, spray, spray, spray. Before it dries completely, you want to take a hyaluronic acid. I have a couple here. I have one by Skin Medica. I have one by PCA Skin. There's lots of hyaluronic acids that are great. And you just pump the hyaluronic acid on and hydrate all of your face. And hyaluronic acid holds onto moisture. It's not greasy, so it's not going to cause you to break out. And it holds onto water. So hyaluronic acid holds onto about 1,000 times its weight in water. So you hydrate your skin with these thermal spring waters because they can help increase the healthy microbiome of your skin as well. That's why I really like them. There's been some studies showing that they can increase the microbiome, which is the healthy organisms on your skin that will actually naturally help protect you as well. And then you add your hyaluronic acid and rub it all in, let that dry. Okay. It's going to take 3-4 minutes to dry, brush your teeth, whatever, then apply your sunscreen. Okay. And that's what you do in the morning. Now at night, what I recommend is doing the same thing, cleanse, and then spray, spray, spray. Add your moisturizer. So like right here, I have Illumier MD. I have Hydrocom because I tend to be a little red. And I will do 1, 2, 3, 4 pumps of that with a pump or 2 of the hyaluronic acid. So now we're taking our heavier moisturizing cream, because at night when our body repairs and renews itself, it also wants to absorb more hydration than it does during the day, okay, because of the way our enzymatic processes are. So I add the hyaluronic acid with my moisturizer cream, and you could use an oil-free cream if you're predisposed to acne. You can use an oil-based cream if you're not. And while your skin is still moist, you just seal it in, rub it all, neck, chest, face, rub, 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 eye cream as well, okay? If you do have a lot of dry skin and itching and rashing, and you just need to get through it, maybe you use too many retinoids, there's a product by Aven called Sickle Fate. I never feel like I'm saying that right, but it's Sickle Fate. And for those of you listening on the podcast, please go to the YouTube channel because I'm showing demos of all of these. And you can apply this as your moisturizer cream 2 or 3 times a day until you heal up. And that's just a really nice restorative protective cream that I like. And if you are someone who struggles with acne, I use this as well, even though I don't struggle with acne because I feel like it's really made a difference in my skin. There is a product I discovered at the Science of Skincare Summit in Austin a couple months ago, and I've been using it and I'm addicted to it. I love it. It's called AO2 Clear. I'll have a link in the show notes on this. And it's oxygenated nanobubbles. And basically, after you cleanse, there's a little dispenser and you apply it to your entire face and it hyperoxygenates your skin. And it really, really helps very well with acne. And I notice it helps me repair quicker if I'm having a laser treatment, and just for routine anti-aging, I'll use it. So that's my rundown on winter skincare. And then as far as internally, what can we do in the winter? So internally, you're going to want to make sure with our skin, we have a bilipid membrane. So we have fat, and then we have like mostly water, and then we have fat, right? So if we're having a low fat diet, we're going to have dry, dehydrated skin. So I usually prefer low carbs, higher fat, higher protein as far as the diet goes. And you're going to want to choose the right fat. So we're talking fish oil. And I like supplementing with fish oil. I recommend pure encapsulations, about 2,000 milligrams a day. And I like astaxanthin because astaxanthin is the pink that is in, wild Alaskan salmon, or krill oil is another really good option. And those are great supplements to take. I'll have a link in the show notes with a 20% discount that you can order. And, obviously eat fish. Try to aim for low mercury fish. That's going to be what you want to aim for. And you just really avoid processed carbohydrates as much as possible because they're very dehydrating to the skin. Alcohol is really dehydrating to the skin as well. So I think most people that are aware of the scientific research, there's not many benefits from alcohol. If you enjoy it once a week, don't beat yourself up, enjoy it, So that's as far as that goes. And then avocado oil is good. Nuts and seeds just depends on the person, and avoid those canola and corn oil, especially. Like read the labels and avoid those. And yeah, that's it with that. Okay. Hopefully I answered that one for you. And the last question I'm going to cover today, where are we with time? Okay, the last question I'm going to cover today is, what are seborrheic keratoses and what can I do about them? Okay, so seborrheic keratoses, how do I best describe them? There's many euphemisms that we call them, but basically, as you get older, often in your late 20s, 30s, you start developing these growths on your body, and they almost feel like a barnacle. Like you can pick them off with your finger. There's no depth to them. You just feel like you can flick them off, almost like a little wart or a barnacle. My patients will come in and they'll describe these growths as, I'm growing barnacles. And I can't call them a barnacle because then people get mad at me. So I basically call them like weeds in the garden of life or birthday gifts from your parents. So basically, as long as we're alive, as long as we're growing, we have these growths called seborrheic keratoses. They're usually brown, they can be tan, they could be red, and they grow every single year that we're alive. And the number we get is often related to how many our parents have. So they're somewhat genetic in the number you get, but I guarantee every single person over 35, 40, I can find at least one on. So you're not alone. We all have them. And they're not precancerous. So insurance doesn't typically cover them being removed from your body because they're just considered something normal that grows on the body. And if you want them removed, they can certainly be removed. I recommend getting them removed by a board certified dermatologist and somebody who understands how to best treat them so that the scar doesn't look worse than the spot in general. So if you're fair skin and you have light skin, we typically will remove them with liquid nitrogen, which is basically freezing them off because they're superficial and they're stuck on, they're not invasive, they're not deep. Then they respond really well to liquid nitrogen. So the goal with liquid nitrogen, because it's negative 197 degrees, so the goal is to get your skin down to about negative 25 to negative 50, form a blister or a micro blister. And then when that spot peels away, when the blister peels away in about 1 to 2 weeks, then it takes the seborrheic keratosis off the area. If it's too big, it might have to be removed cosmetically. And you have to pay for these because insurance doesn't cover it. So just be aware of that. The other thing is removing what you have doesn't prevent new ones from forming. So as long as you're alive, you're going to form more. Now, if you have dark skin, if you have like Asian, African American, dark Hispanic skin, let's talk medium skin tones. So if you're Asian and Hispanic, so I get these frozen off. I get them frozen off my torso all the time. Well, once a year, pretty much. Then I tend to get post-inflammatory hyperpigmentation, a brown spot there for about 6 months afterwards. So it looks like a little brown scar, almost like you get after you have acne or a scratch or something. And that will fade slowly over time as long as you're not getting in the sun. If you have dark African American skin, Fitzpatrick 5 or 6, and you use liquid nitrogen, it can kill melanocytes. And you're left with a permanent white scar. So liquid nitrogen in African American patients is not my favorite choice of treatment. I recommend hyfurcation or electrocautery device, where it's a heat energy that can be precisely applied. And when I worked in Washington, D.C., I had a lot of patients with a condition called dermatosis papulosa nigra, or DPN, which basically you can call Morgan Freeman spots. It's the spots that a lot of African American people will get on their cheeks and, upper face, and they're smaller than what we see as a seborrheic keratosis. And I love hyfurcation for that treatment. So typically what I would do in the office is I would take a spot on the periphery of the face and I would do 2 or 3 spots with hyfurcation, have the person come back in 2 weeks, and I don't charge for that. Have the person come back in 2 to 3 weeks, and then basically hold the mirror in front, say, how do you think of that? Are you good with that? Is that an acceptable scar? Because whenever we're treating something cosmetically, we want to make sure the scar doesn't look worse than the spot to begin with. So most people say yes, and then we kind of plug along and we go more centrally, little at a time. You don't ever want to do anything dramatic unless you have a problem with it. So in general, with seborrheic keratoses, they're not precancerous. They have no higher risk of developing cancer than the skin next to it. Can they develop cancer? Absolutely. Same rate as the skin next to it, because sometimes there could be collision lesions where you can get a cancer and a seborrheic keratosis in one, but they are not considered precancerous. They're considered cosmetic removal, and they can be removed. You just have to make it clear to your doctor that you want them removed if you have them. The other thing about seborrheic keratosis that I notice is that people may develop more at a faster rate under a couple of conditions. If you're gaining a lot of weight quickly and you have an increase of growth hormone or IGF in your body, basically, if you have an increase of IGF in your body from gaining weight rapidly, if you have uncontrolled diabetes, if you're pregnant, because we're growing a human, those are times where I notice that you can get more seborrheic keratoses. And there is a very, very rare condition called lesser trellat where a huge number of seborrheic keratoses can form overnight. We're talking thousands, and that can be an association with a malignancy. But if you're getting, 10 every couple months or, 100 a year, that's not something that we consider to be worrisome for malignancy. So I don't want you to worry about that. So that's the seborrheic keratosis. The other thing I want to bring up while we're talking about seborrheic keratoses is that there's something else that we can naturally grow in our body as we get older, and they're called Sherry angiomas. And they look like little red dots. So they're just little red dots, and those are made of blood vessels. We don't know why these things form. They just form as we get older. And those can be cauterized cosmetically as well in the office. And cosmetically, I mean, just because you don't like the look and not covered by insurance. So that about ends it. And I hope I answered all of your questions today. And if you have future questions, I will be doing one of these AMAs every month. So hit me up on Instagram, DM me at Dr. Jen Haley, or go on YouTube and leave a comment. I'm finally on the YouTube channel and I'm paying attention to it. So I would love if you can subscribe. And if you like this podcast, please leave a review and subscribe. Thank you. Take care, everyone.
If you're enjoying the Radiance Revealed podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, please give us a review, as that helps others to find this podcast. And if you want to connect with me, please visit my website, drjenhaley.com, or you can find me on Instagram at drjenhaley.
Hello, everyone. Just a friendly reminder that this podcast is for educational and informational purposes only. The statements and views expressed on this podcast are not medical advice. Opinions of guests are their own, and this podcast does not endorse or accept responsibility made for statements made by guests. Neither this podcast nor any of the information contained within it are a substitute for care by a qualified medical professional. This podcast is provided with the understanding that it does not constitute medical or professional advice or services. If you are looking for help in your journey, please seek out a qualified medical practitioner.